Well, infection control is nothing new to dentistry. For decades, we've dealt with infectious diseases, hepatitis B and C, HIV and AIDS.
Well, the great thing about what we do is that infection control was the normal from the get-go. And so with our sterilization processes, which are hospital-grade sterilization, and all of the infection control processes we do throughout the entire office, keeping our patients safe from us, something that we might have, has always been the norm.
Certainly with COVID being a new virus and not having much immunity to it, then we have certainly amplified our protocols.
So one thing is we're using the respirator masks, which is new for us. And we're also using the face shields.
When you arrive, you check in and you can wait in the safety of your own car, and you'll be contacted by our staff when it's time for you to come in, and you will be greeted by someone who will take your temperature again so that we can be assured that you're not symptomatic, and you can know that everyone who has come in before has also had that and gone through that process.
One of the things we're also doing in regards to the air is we're waiting and we're giving time in between each patient, especially for those that are seeing the dentist for a real dental treatment. And by doing that, we're able to go through another cycle of disinfection to double the efforts of disinfecting the operatory before the next patient comes in to be seen.
And we've really streamlined the flow through the office where you're entering through the waiting room and again are the only person in there, but we have one way exiting out so you don't have to worry about patients passing you. Masks are required in the office, and that is for your safety as well as the safety of everyone. And again, along with that, definitely amplified our hand hygiene everywhere. And again, we're asking that of patients. We want patients to know that and to have that opportunity when they come in so that you can have that hand sanitizer to use, but know that our staff is as well. Lots of hand washing, lots of hand sanitizer. Every day when the staff members arrive at the office, there is a temperature screening, and the same screening questions are asked of them as we ask of our patients. Out of no one leaves the office in their clinical attire or shoes, and again, before they leave, there is another temperature check and screening questions asked before they exit, just to make sure that no one has become symptomatic throughout the day.
People are asking that question, should you do regular routine dental care during this time? And I think the best answer is that if you have concern about it, then that's something that you should talk to your specific doctor or dentist about so that they can help you. Because for a lot of people, waiting and having it be a year since the last time that they were able to have care would have a really negative impact. It gets kind of nitty-gritty talking about it, but we had situation where we had buildup that ended up leading to having a major gum infection because that buildup wasn't able to be cleaned off during that time period. We had cavities that were probably borderline but not causing any trouble, and then because of that time period ended up having pain in the tooth. In general, I would say yes, it's safe and it's smart to have this routine dental care done.
We rely on the Department of Health on a local level, Frederick and Washington counties, but we've even consulted with Maryland Department of Health. When we have questions as things change, we call them and we've communicated our protocols and the things that we've implemented in the office, and you can feel reassured that they have endorsed what we're doing. They feel very positive and they're very happy about the protocols that we have put into place.